Good morning. I'm Dr. Stephen Wallach, and today I am performing liposuction on a young woman who is unhappy with the way her abdomen, her waist, and her outer thighs look. In this technique today, we'll use multiple little incisions to gain access to the liposuction. We will infuse fluid through these different access ports to tumescent the area. This is made up of a lactated Ringer solution, which is a sterile solution, along with epinephrine, which constricts the blood vessels or tightens them up to minimize any blood loss. And also it has lidocaine in it, which is a numbing medication. Once this fluid is infused into all the areas that we're going to treat, we are then going to perform liposuction. The liposuction is performed using various different cannulas, which are tubular structures that have multiple different holes in it and of varying size and width. And with these cannulas, we'll remove the fatty content of the areas and improve the contour of the patient. So right now I'm infusing fluid into the tissues that are between the skin and the muscular layer. This is of the abdomen. I'll be infusing here as well as the waist and as well as the lateral thighs for this patient. Once we have adequate tumescence, we'll then start the procedure. So we've just completed the infusion of the fluid for tumescence, and now we're going to start the liposuction. I'm using a 3.7 millimeter cannula, kind of a mid-size range. Some people like to pre-tunnel. I'm pre-tunneling a little bit to open up the pocket and area between the skin and the muscle to open up the fatty layer. And then I'm going to start the liposuction. And the liposuction is done in the same motion as I am doing now. And now I'm performing the liposuction. You hear the vacuum suctioning device at the bottom of the table suctioning, and the fat's coming out through the tubing here. And you'll see it as I do the liposuction. It's a back and forth motion. And you see all the fat that's coming out through the tubing is the liposuction fluid as well as the fatty tissue. So we are done with the procedure. I am closing up the small incisions with some sutures, and the patient will be placed in a compression garment which she'll wear for several weeks after the procedure. The sutures will come out next week. This is the final result of what we took out, the final volume from this patient's abdomen, waist, and outer thighs. It's approximately 3,100 cc's of fat, maybe a little bit more, with some obviously tumescent fluid at the bottom.